preventing and treating knee injuries in people who are actively involved in dynamic sports and exercise remains a major challenge.
For the past 2 decades or so, quite a few research teams of clinicians and scientists across the world, primarily in the United States and in Australia, have all been investigating whether we could reduce the amount of injuries players have at their knee and how they have done that.
This work is needed to provide better guidelines on how to try and prevent knee injuries. For example, by helping coaches introduce warm-up routines or specific muscle routines in their training sessions, and also to be able to better treat us when we actually have an injury.
For anyone who tries to be healthy by doing some sports or exercise, injuries to our legs are the biggest threat, and they can keep us out of business for quite a long time.
Particularly knee injuries can cause a major blow to our sporting plans, as they are often very difficult to recover from. Serious damage to the ligaments can keep us away from the field or court for 6 months, and easily up to more than a year, particularly if it involves surgery.
Census studies have shown that if about 20 healthy sporting people were sat in this room, you can be quite confident that over the course of about 5 years, at least one of them will actually suffer a knee injury. And if these 20 were women, then it would be more likely 3 out of 5 out of those 20.
Considering that each single one of these 20 people would want to get the best treatment, we think it's crucial in the first place to understand how the way they move during playing their sport can actually lead to knee injuries.
We have teamed up with expert research groups from Australia and from Belgium and realised through systematically reviewing all the evidence that can tell us something about who suffers now really from injuries, that there is a serious need for a lot more scientific observations.
This has shown us that those of us who do get injured actually did not get that purely through pot luck. Some of us actually have more of a chance to get injured because of the way their body is built, because of the flexibility in their joints, and apparently even because of the way they move when doing their sport.
Particularly the way we move is exactly what we have found there is still a lot of evidence missing for. So we have decided that we want to help all of these research teams across the world by drastically expanding the amount of observations on which coaches can build their training programs and on which clinicians can build their treatment plans.
Here at Liverpool John Moores University, we are experts in understanding how particular movements can cause knee injuries, and we have unique facilities.
We will make a number of observations at the beginning of the season, mostly related to how people move and how their muscles work. And this only takes about 2 hours in the lab in Liverpool.
Then we will need to follow everyone throughout a full season, which consists of answering 2 questions every week. 1. Are you playing as much or as little as you usually do? 2. Have you got injured in the previous week? We've developed a mobile phone app, so this literally takes about 5 seconds to do so.
Whilst this study will take a number of years to complete, we will be following the players for 1 season only.
Anyone who is involved in sport, such as football in its different forms, rugby, basketball, volleyball, netball, etc. Basically sports that involve dynamic movements across a pitch or court.
They just need to be between 18 and 35 years of age and happy to be tested once in the lab here in Liverpool. The bottom line is that we need to get as many as possible people, so if you know anyone, do feel free to spread the word.